Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, feeling a little bit off balance will help you stay steady. Then we'll share input on dental implants. You're invited to a class reunion that's been 100 years in the making. And how to protect your home when you need a nursing home.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. The statistics are startling. Falls are the leading cause of death due to injury among the elderly, and 87% of all fractures in the elderly are due to falls. So what can you do to prevent falling at home? Mimi Pekarik, a physical therapist and director of outpatient therapy at the new VO Wellness and Aquatic Center on the campus of Breckenridge Village, is here, along with David Schell, the executive director. Welcome to the show.
Thank you.
Nice to be here, Lori.
Well, David, let's start with you. In your 20 years of experience working with older folks, is this really this much of a problem?
Lori, the word that comes to mind is huge. You talked about the issues as being one of the leading causes, and it is the #1 leading cause for non-fatal injuries and trauma as well. And also, it really inhibits and creates the potential of kind of impeding our ability to do the #1 thing we want to do, and that's stay mobile and active. And in 2010, although I always kind of questioned statistics and numbers, we spent $28 billion in the United States on falls, medical care, and the related issues as a result of falls.
Yeah, another word comes to mind, huge again,
yeah,
and
huge,
how much that
big
is.
Numbers.
So David, can you review why do people fall?
Well, I guess it leads from everything. I mean, just being a klutz, and I mean that happens to all of us, but then also the medical community tells us that things like low blood pressure, changes in medical condition, neuropathy, or the numbness in one or both legs. Sometimes just really simple things like changes of environment or changes in glasses, going to bifocals or trifocals, arthritis, some of the age-related issues. Also changes in posture and medication is huge.
Okay. Well, Mimi, last time you were here, you put Armin through the ropes, gave him a simple balance test, which maybe is not so simple. Are there some things our viewers could do at home to help improve balance?
Oh, absolutely, Lori. But first, before anyone would start any exercises, we'd want to make sure that you're appropriate to do those. So you should check with your doctor first.
Sure.
But once you've gone through that, then you need to be safe doing the exercises. So I would suggest that you would position a chair in front of you and do it with a wall close to you behind you, because we don't want you to fall while you're trying to improve your balance.
That's true.
First of all, what you can do is stand and just work on swaying forward and back using your ankles, because our ankles are one of our main sources of stability. The second thing that you can do is try to balance on one leg. And again, try not to hold on, so you're truly working on your balance skills. And the third exercise that you can do, you might not think about it, but if you stand and move your head up and down and rotate your head side to side, you're actually activating your inner ear balance strategies as well, and that can help you quite a bit too.
I would not have thought of that. That's a very good one. I also understand that there's a new tool at the VO Wellness and Aquatic Center to help people improve their balance. Tell me about that.
We have, it's called the NeuroCalm Balance Master, and it is a state-of-the-art piece of equipment that is used not only for testing but also for rehabilitation. What we use with it for is to look at the sensory components of balance, which includes your inner ear, your joint receptors, as well as your vision. So it combines all of those factors to give us a good idea of where the main problem areas arise so that we can work on the right area to improve.
It looks like a very useful machine, it sounds like it. So David, is there a way that people who are not residents at Breckenridge Village can take advantage of this machine?
Absolutely. I mean, one of the wonderful benefits for the residents is that it's available, and we do a lot of preventive work. But then for individuals out in the greater community, if they're having surgery, they can contact Fairmount Health Center at Breckenridge Village for inpatient rehab, or if their doctor writes an order, or if they would like to have a balance assessment, they can contact us, and Mimi can do that at the VO Wellness Center.
Fantastic. All right. So, my thanks to Mimi Pekarik and David Schell for some sound advice about falls and how you can improve your balance. For more information on Breckenridge Village and the NeuroCom Balance Master, please call the number that's coming up next.
Learn more by calling Breckenridge Village at 440-942-4342 or log on to www.breckenridgeohio.org. Next, the truth about tooth implants.